Having a healthy heart can start as easy as brushing your teeth. Today we're going to talk about the disease endocarditis. If you are happening to wonder what endocarditis is, it is an inflammatory infection of the lining of the heart chambers and valves. The infection can cause damage to your heart and cause serious and sometimes fatal complications. It is a cardiovascular disease, that is why it's a heart problem. It comes in through your mouth, from eating, or from skin sores. Anywhere that it can get into your bloodstream is where it'll come in. The microorganism is less likely to attach to a healthy heart, so if you haven't had previous history of having like heart problems such as rheumatic fever or anything like that, then you are less likely for this disease to attach. Now we're going to talk about the symptoms. The symptoms would be like a heart murmur is present in about 80 through 85% of your patients, so that's a really big one. Fevers are usually present as well in all of your cases, which fluid buildup on your feet, hands, anywhere on your body really you notice you're swelling. That's also another sign on it. The Mayo Clinic actually announced that if you notice a good amount of weight loss, this also is another symptom, and fatigue and body chills. So it's really a lot to do with your body that shows you signs. When you're trying to diagnose it at your house, those are just light things to look at. Also, if you have nail hemorrhages, which people call them like splinters, they're under your nail and they literally just look like you have a splinter. And then inflammation of the heart valve, which the only way to find if you have inflammation of your heart valve is if you are having those symptoms and you do go to the doctor and they check you out. Now we can move on to like typical causes of getting endocarditis, what makes you get it. WebMD announced that 50 to 80% of infective endocarditis cases have streptococci present, which streptococci is a bacteria. Previous heart problems such as like rheumatic fever, like I discussed earlier, that can cause you to have endocarditis to attach into your bloodstream. Dental procedures, like if you go and get surgery done, if they cut anything in your mouth, which they will for a surgery, there is the chance of you getting an infection in it, and then that infection can lead to your endocarditis. Catheters, needles, anything like that that goes into your body can cause you to get this. Even brushing and flossing your teeth, because if you have bad dental hygiene or anything like that, it is easy for you to get endocarditis because of the bacteria and infection in your mouth. It's easier for it to attach as well. And then the case rate may vary between about 2 to 3 per 100,000. About 55 to 75% of patients with the valve endocarditis have valve abnormalities, and another example is rheumatic fever. Rheumatic fever plays a big part in endocarditis. A lot of people have had that previously before they get endocarditis. The population-based incident of like 4 to 10 per 100,000 people per year. The rate is actually higher for men to get this than women. I am not exactly sure exactly how, nowhere did it say, but it did say that men are more typical to get endocarditis. The medical dictionary announced as well that the mortality estimated at 1 per 100,000 per year. So it's not a huge thing, but that is a good number. And anytime you think you might have this or anything like that, you do need to get it checked out and go to the hospital just to be 100% sure. A different type of bacteria that you can get from endocarditis, it's not as high risk as infective endocarditis, but it's subacute endocarditis. This is just like mild toxicity, and it actually doesn't become present for like weeks to months, so it's harder to distinguish, and it makes it harder because for endocarditis you want to be able to know you have it quickly and act on it quickly, or it can cause serious problems such as death. So most commonly associated with the S. viridans, which is another bacteria, just like the streptococci, and then it rarely leads to the infection. So it's a better side of endocarditis, but it still can be serious. And then next is more like on blood culture, like what they're going to do when you go to a hospital. Blood cultures are really important in endocarditis and seeing if you have it. The infection, what you're going to look for from your blood culture would be like S. aureus, enterococcus, viridin, streptococci, and enterococcus. Those are all just a different type of bacteria that you can find on your blood culture that might sign to that you do have endocarditis. Like I had said, the blood cultures are the most important tool used to diagnose endocarditis, so most everybody that goes in there and has the signs, they will give you blood cultures. And your blood will be drawn several times over the 24-hour period because they're going to try to check if it's getting more better, or it's getting worse in 24 hours, and how they need to treat it. once they've done the 24 hours, they will put it in a special culture bottle that allow bacteria to grow. It makes it grow faster and quicker so they can get results more quickly. Sometimes, though, the blood cultures don't grow any bacteria, and if this is the case, the person still might have endocarditis, and the next way to distinguish it is a culture negative endocarditis is what it is called, and it does require antibiotic treatment as well. It's just harder to find. Other blood tests are also done to diagnose endocarditis. A complete blood count may be used to check the number of red and white blood cells in your blood, just to check how high they are, how low they are, to see if there's an infection present. And then onto the prevention side of it, what you need to do to prevent having this possibly happen to you or happily get endocarditis, you need to pay special attention to your dental health, because just even like dental checkups regularly and making sure your gums are clean, your teeth's clean, anything like that makes you have more of a healthy mouth, and that works better as in that the bacteria won't get in through your mouth and you have less likely chance of getting endocarditis, because your mouth is the best place for organisms to grow. And then you need to avoid procedures like skin infections or getting body piercings or tattoos. Be avoidant of getting any of that done, because there is a chance, since it is an open wound, it can get an infection in it and then cause you to also get endocarditis. And as I was saying, like if you do have any cuts or any sores and they kind of seem like maybe you do have a skin infection or maybe you do have something abnormal, it's not like a normal look to you, then you do need to seek medical attention quickly, because like I was saying, if you don't act on it very quickly, then there is a chance that you could be too late and it could cause death. And then onto the treatment part, what you want to do that they'll do for you to treat endocarditis would be very high doses of antibiotics. Treatment with penicillin is used for most infections caused by the streptococci, which is the bacteria I was talking about earlier. But then some people have a high resistance to penicillin and it doesn't work as well for them. So then they mix a combination of penicillin and gentamicin, and that side is caused by the enterococci, and that's for the people who are highly resistant to penicillin. And then even if that side doesn't work, then they're going to move on to the vancomycin, and that's like about the highest one you can get to get this disease gone and infection gone. But the thing is, a dose of your antibiotics you should never skip. You should never skip or stop early, because there is a chance that if you do stop early because you think that your infection's gone, that it will come back. You need to always do your full dose of antibiotics. So, endocarditis is a very serious disease, and brushing and flossing daily is very important and a simple preventative measure to take, and just making sure you can't get endocarditis or anything like that. But the purpose of today was to learn more about how important your heart health is and dental health is to your body, because it is so important. Like little steps you can take make such the difference in your health, your daily health, everything. I hope you guys use the helpful tools you learned today and be aware of your health. And always seek medical help if you are not sure. Thank you.
I'm Riley. I'm Megan's friend.
I'm Amira. I'm Megan's friend.
I'm LaFonda. I'm Megan's friend.
I'm Daniel. I'm Megan's boyfriend.
I'm Katie. I'm Megan's friend.